In the clip, we saw a son who's taking care of his mom, and his mom has Alzheimer's, and therefore his mom's not going to be able to be asking questions and researching and reading in the book about the different pills. And so it's a family responsibility. And luckily, in this case, he had a very alert and loving son who was well informed, and he knew something was wrong. He jumped in there and got things going straight. But let me just tell you, a involved, active family member who can participate with an older relative in looking after the medicines can be a lifesaver. I'll give you one other little concrete thing that people do that's really helpful. If you ever look at the checkout stand at the pharmacy, you'll sometimes see these little plastic pill caddies.
Yes.
I love them. I think they're great. And with older relatives, sometimes a caregiver, like a son, can come in once a week and fill the pill caddy, and then that takes the guesswork out of taking the pills and what's been taken and what's not been taken, helps reduce missed doses, helps reduce people forgetting that they took their medicine and taking a second dose. Can be really handy, and it's something to think about if you're helping somebody you love take care of their medicines.
That's fabulous information. Are you ready for a few questions from our audience?
I'd love to.
Do we have some questions here?
You've talked about generics as a way to lower costs, but are they safe and as effective? Because I have friends who feel that brand name medications are superior.
Yes. That's a very common view in our society, the idea that brand name drugs are automatically different from or better than generic drugs. Here's the way I like to explain it to people. If you go into one restaurant and have a dinner, you'll see a salt shaker on the table. It can be one kind of salt shaker. You go into another restaurant, you'll see another salt shaker on the table. It'll look different pattern or a different design. But the salt inside the shaker is exactly the same. So a brand name drug has a purple color or a round shape, and the generic pill might be white or green or blue. It's not the covering on the pill that matters, it's what's inside. And the FDA guarantees America that what's inside the generic pills is exactly the same as the brand name pill.
Great. That's a wonderful question. Do we have one more from an audience member?
On every prescription bottle, there's an expiration date. Yeah. Just how important is it to follow by that expiration date? Meaning, if you continue to take the medicine after the date has expired, do you have any chances with your ailment reoccurring?
Wow, yeah. You know, cartons of milk have an expiration date on them also. And people in general would be quite reluctant to pour out a big glass of milk from an expired milk container because you'd be worried about spoiled milk. The same thing can happen with prescription drugs. They can lose their effectiveness or even spoil over time. If the pill bottle says that those pills have expired, the pills need to be disposed of properly. Using outdated medicines, and I'll tell you something else that goes on. People lend medicines or give medicines. Oh, I've got a bottle of that at home. You know, it's 2 years old. Would your friend give you 2-year-old milk? If these are chemical compounds, they break down over time, and if you really want to get the value out of the medicine, you need to use it before the expiration date.
Dr. Thomas, thank you so much for all this valuable information. Any final thoughts, words of wisdom you'd like to leave us with?
Well, I'll just say, based on my experience with people, the thing to remember is that prescription drugs are incredibly powerful, incredibly valuable, and also very dangerous. And maybe the most important medicine of all is common sense. You know, get out there and learn about the meds you're taking, ask your doctor questions, and be a good partner with your physician.
Great. Thank you again very much. And as we close, we'll show you some ways to find more information. Medicines Made Easy can be ordered from AARP. You can write to AARP at 601 East Street, Northwest, Washington, D.C. 20049, or go online to www.aarp.org/usingmeds, or call 1-888-OUR-AARP. Inside that booklet, you'll find your personal medication record. This can also be ordered in Spanish. And another publication you may find helpful, Let's Talk About Medications, which is also available in Spanish. And here are some of the additional online resources that you can use. Medicines and You, Research Your Health, and a consumer guide. And remember, conversation is always the best medicine. Thank you.